accurately diagnose your pet with an illness. Now, here to tell us more is Adam Foret from University Veterinary Hospital. Adam, thank you so much for joining us.
Good morning. Thank you.
All right, so you guys have opened up a new building right next to your old one, and with that, you guys have a lot of equipment in there. So we're going to talk about non-invasive imaging, right, today?
Yeah, so there's some really cool things out there, and what does this mean to your pet? You know, and it's a lot of people are familiar with these terms and know kind of what it means to them, or they've had a family member that's had some of this stuff. But what does it mean, and how can it help? And that's what I want to talk about a little bit. And one of the first things are some technologies that have been around for a while. And one is ultrasound. So what is an ultrasound? Well, it's using an ultrasound beam, and it goes through, and it's like a radar. It's kind of like the weather, right? So it uses a beam, and it goes through, and it bounces back, based on what the tissue is. And this is a way that really, you can get a look at a heart. You can get a look in the abdominal cavity while they just lay there. The animal just lays there like a belly rub. And it's really cool, and there are some implications for this and some things that it's not a scary procedure, but you can absolutely learn a lot while they're fully awake.
And what's interesting about that is you think of ultrasound, you think of when somebody's pregnant, you can see that. Is that the same for pets?
We look at it for different reasons, and pregnancy is one of them. It absolutely is. So whenever we're looking at prenatal care, looking at puppies before they're coming out, making sure that everything's okay, ultrasounds are really a big help with that as well too.
All right. One of the other things you use is actually digital X-rays. Talk about that.
Yep. So X-rays are actually using a beam, and essentially we're using radiation, and then you're getting a two-dimensional image or a one-dimensional image, and in different views essentially. And X-rays are very helpful. It's old technology, but it still is for certain things. It's state-of-the-art, for what it is. The neat thing about X-rays these days is that it's digital, and it can be sent around the country in a matter of seconds. And so the teamwork and the knowledge is bringing in specialists to look at areas in a matter of seconds and getting information very quickly.
And the big one that you guys have is actually a CT scan. So talk about how that is
beneficial. So CT scan, and CT stands for computed tomography. And what CT is doing is taking radiation basically and making a three-dimensional image of what you're looking at. And so the animal goes into basically, it looks like a big donut. Most people have seen what this looks like. And it's so fast. The technology today is so fast, the actual scan itself probably takes 30 seconds to a minute. It's really, really fast. From there, the data is collected, and you can look at things in multiple dimensions. And this is really helpful in a lot of areas. It's helpful in understanding disease and or wellness in areas that are hard to get to, so like the sinus cavity. And dogs and cats have very, very intricate sinus cavity, and we see that, and inflammation in that area is a pretty common thing. In understanding what's there and how to best treat it, and we can answer that. The spinal cord, so whether it's an injury or we're looking for disease in that area, we're able to make a 3D image of that area and understand what's there, and it's really, really cool. In the abdomen, same thing. You're able to really get a good view of what's going on and then make decisions, and ultimately make decisions in surgical planning. So if there's even an orthopedic surgery that needs to be done, to understand all of the facets of what's there to best plan, so ultimately you can have the best outcome. So it's really safe technology. It's really cool technology. So it's really, really neat that it's in this area now.
Yeah, and all this technology is at UVH, and Adam's written a blog on this, so we're going to have that on our website after the show. Adam, thank you so much for joining us.
Thank you.
Yeah, we want